Does my neurologist actually know what's causing my migraines, or is he just going to keep telling me to take medication? The inspiration for this question came up because a member of my free Facebook group, Healing Migraines Naturally with Leslie Caesar, ND, posted this question in the Facebook group after she had returned back home from her neurologist appointment. So she said, funny enough, today I had to go to the neurologist. I had my, neurology appointment, and I had a pretty severe migraine. And my neurologist doesn't think that it's coming from my neck, even though that's where I'm having a lot of the pain. I think it might be related to the lack of sleep. But then she asked this very common question: does my neurologist actually know what's causing my migraines, or is all he going to do is keep telling me to take medication? And so let's unpack this question, right? Because there's a lot going on here with this question, and I resonate so much with this question because this is the question that I kept asking myself when I would leave my doctor's appointments with a prescription. Okay, when I first started getting migraines. Welcome to the Healing Migraines Naturally podcast. I'm your host, Dr. Leslie Caesar, and I am a naturopathic doctor, former chronic migraine sufferer, and I help women all over the United States who have chronic migraines stop getting chronic migraines, get off their unwanted medication, and do it all without taking fistful of supplements. So thank you so much for joining me today. Today we're going to answer one of the most common questions that people ask when they leave their neurologist appointment. So let's unpack this question, right? Because there's a lot going on here with this question, and I resonate so much with this question because this is the question that I kept asking myself when I would leave my doctor's appointments with a prescription. Okay, when I first started getting migraines. I'll kind of use myself as an example. So I first started getting migraines when I was a young adult, just sort of starting out in my career in the working world. And I was about 24. I would start to get migraines around 3-4 o'clock as the end of the workday came about. And then I had a very long commute through the Chicagoland traffic to get back home. And by the time I would get home, I would kind of just stumble into my apartment and collapse on the couch, and that would be it for the rest of the day. And like most migraine sufferers, these episodes started out to be not that frequent. And at the beginning, I would just sort of, collapse, lay on the couch, watch TV for the rest of the night, go to bed, and wake up the next morning, feel like myself again. But again, as is typical, because I wasn't doing anything to address the underlying root causes or reasons why my body was generating these migraines, like most people, the migraines continued to get more and more frequent over time, and the severity got more and more severe, worse and worse over time. And so I started using over-the-counter Advil because just kind of laying on the couch and going to sleep wasn't cutting it anymore. And so I started taking Advil. And then it got to the point where I was pretty much every other day, this was the routine. And it got to be a pretty old routine. And so I had a primary care doctor who I really liked. And I decided, you know what, let me go into her. Because clearly, by this time I was starting to realize, there's something driving this, right? There's got to be a reason why this happened to me, right? What are the underlying factors that are the reason why my body is generating these migraines? Because if an expert could tell me what they are, and then I could take the right steps to correct that, I bet you these migraines would go away, right? So again, I think we all have this intuitive knowing, right? Like there's got to be a reason why I'm getting these migraines. And so doctors figure out what are the underlying causes here, and then they recommend that you make some changes, right, to address those root causes, and then you're going to feel better, right? Your body's going to respond to that, and you're going to feel better. And we assume that that's what doctors do. That's certainly what I assumed that my doctor was going to do. So I went into her, and again, very nice woman, and I told her I thought I was going to go in because I was just seeing her, like once a year for like annual checkups. Now I actually had like a real problem that was bringing me to the office. And so I thought we were going to do a deep dive. I thought we were going to talk about how, these started off intermittently and then they started getting worse and worse. And I was going to go through this whole big, history and explanation and, everything. Not so much, right? Because the typical doctor's appointment is less than 12 minutes long, right? So they're not going to go into that level of detail with you, particularly a primary care doctor, which this doctor was, because they are getting paid via my insurance reimbursement. They have to keep the patients moving or they won't make enough money to keep the clinic doors open. So I was a little shocked at the lack of detail that we went into. But what she was looking for, right, and this is what doctors are looking for, okay? Medical doctors, when you go in, they're not looking for the underlying root causes of why your body is generating the migraines. That's not what they're there for. Hi there, it's Dr. Leslie. If you're a woman having 8 or more migraine days a month, let's talk. I'll show you how to drop them to near zero in 90 days. And that's without adding more medication. In fact, you can even lower or possibly even completely wean off of your medication within 90 days. And that's without any agonizing cold turkey withdrawals. So let me tell you about one of my clients, Judy. She was nearly bedridden because she was having to take such strong medications for her migraines, and she could barely function. In fact, she had to close the doors of her small retail business, and she was feeling like a failure. She wondered every day, why was she doomed to suffer from migraines? But just like you, she found this Healing Migraines Naturally podcast, and a spark ignited. She knew that if she could just figure out why these migraines started in the first place, she could restore and recover her health again. So she booked her free consult call, and the rest is history. Now she reports months in between migraines and runs her small business full-time again. She followed the 12-week plan and got incredible results, and she's completely weaned off of all of those preventative medications that were leaving her feeling doped up and committing her to being bedridden. I have worked with women just like Judy from all over the United States overcome migraines naturally. So if you're serious about healing your migraines, then tap the link in the description and book a free consult call with me, just like Judy did. We do cap new clients monthly, so if the calendar's full, the doors are closed for now. So don't wait to reclaim the life you deserve to live. No matter how hopeless things seem now, with expert guidance, your body can heal and recover. So I look forward to chatting with you. Click the link now to schedule your call. What a medical doctor is there for is to listen to the symptoms and determine the diagnosis based on those symptoms. Maybe some lab work or imaging would need to be run in addition, but with migraines, you can diagnose migraines just simply based on the symptoms that people describe. Any medical diagnosis is done by interpreting the particular symptom picture or the symptom pattern. And so the migraine diagnosis can be made based on the symptoms that the person experiences and describes to the doctor. Okay? And so once the diagnosis is made, then the doctor follows what is called standard of care. So this is almost like an algorithm or a checklist that the doctor follows once the diagnosis has been made. If the diagnosis is in question, then additional data is going to have to be collected, either from the patient via description of what they experience, or lab work might need to be run, or imaging. But once the diagnosis is determined, then the doctor follows standard of care. Okay, so with migraines, once that diagnosis is made, okay, this is what we have going on, it's migraines. The standard of care would tell the doctor, you're going to prescribe a triptan medication. Okay, so the standard of care, like I said, it's almost like a checklist. It's almost like an algorithm that the doctor goes through. If it's this diagnosis, then it's this medication. And medication, it's almost like there's a ranking. Okay, so, if somebody has a diagnosis of migraines, and this is, right out of the gate, they're not going to start the patient on, Seroquel. Okay, they're going to start with the first medication that's on the checklist, on the algorithm. And that first medication is going to be, the easiest to tolerate medication, the medication with the least amount of side effects, probably the medication that's been around the longest, is now in a generic and it's, inexpensive, right? They're going to start with the least thing first and see if you respond. And the response is, does this medication alter your biochemistry well enough that you don't feel the symptoms anymore, right? So, in this case, if I was given a Imitrex prescription, okay, I don't remember the specific, medication that she gave me that at first appointment, but I have to assume that it was a triptan medication. So it's like, we know out of the gate, right, that the medication, that the prescription that we're receiving, that we're going to take into our body is not addressing any sort of underlying root cause deficiency, something like that, right? We know when we're taking that medication, just like I knew when I was taking the Advil at home. I don't have an Advil deficiency, right? I know that. I'm just taking the Advil because it's going to cut down on this pain, right? So assessment then is, if I take the Imitrex, does the Imitrex work well enough so that I don't experience the symptoms of the migraine anymore? Okay, so that's what your doctor is thinking when you go in there. The medical doctor is not thinking about, okay, what could be deficient in Leslie's body here? What could be a barrier, a roadblock, a missing piece? Are there any mental and emotional factors that were at play when these things started in her mid-20s? None of that is a consideration. What the doctor is trying to determine is, first, what is the diagnosis? Because that's going to drive the intervention, which, in 99 out of 100 times, is going to be a prescription medication. Okay, or, maybe the recommendation of an over-the-counter medication, but it's going to be some sort of medication to alter the biochemistry so that the patient can't experience the symptom anymore. And that's considered success. Okay, if you can take an Imitrex and you start to feel better, half hour, an hour, you can function, you can stay upright, that's considered a success, right? You're responding to the medication. Now, intuitively, we know that this isn't really what we're looking for, right? I mean, we're looking for relief, right? For sure, right? Like, because we can't take it anymore. That's what drove me, right? I couldn't get relief anymore from the Advil, right? Because as I've talked about on this podcast, I have a free training that talks about this. Over time, when we suppress the symptoms that our body is generating with something like Advil, like I was doing at home, over time, the body fights that suppression and it starts generating more of the symptom. So as I continued to take that Advil, my body was like, okay, well, here we go. The conditions for the migraine are still flourishing here inside of Leslie's body. And if she's going to take Advil, I've got to figure out how to generate the migraine with the Advil on board, right? And that's exactly what my body figured out how to do. And I couldn't get relief, right? I wasn't satisfied anymore with the relief that I was getting from the Advil. And that drove me to the doctor, right? So again, for most people, when the migraines start, they're intermittent, they're not that severe, and we say, well, this was rough, right? This was no fun. I certainly don't want to take Advil or Excedrin or aspirin, whatever it is over the counter. I certainly don't want to take it. But I guess if I'm going to get this, 2, 3 times a year, I guess it's not that big of a deal, right? I mean, how bad could it be to take Advil a couple, 2, 3 times a year, right? So, for many of us, this is how frequent the migraines were when they started. They were not really a factor in our life, right? They were only happening a few times a year. And when we weren't in the migraine state, we forgot about them, right? We were just feeling like ourselves, right? And we weren't thinking about these migraines until they hit, right? Then we really know what we're dealing with here, right? Then we really get concerned. But then over time, right, because we haven't addressed the underlying conditions that are generating the migraines, we are taking this suppressive medication, the body starts generating more and more. And what turned into, what used to be 2 to 3 times a year turns into 2 to 3 times a month, turns into 2 to 3 times a week, right? And by that time, the over-the-counter, taking some Advil and taking a nap, it's not going to cut it anymore, right? So now we realize, okay, there's something going on here, right? I can't ignore this anymore. I've really got to get to the root of this problem. And, then you think, well, I'm going to go to the doctor because that's what doctors do. That's what I thought doctors did. I thought you went there and you told them what was going on, and they did a detailed investigation and they figured out why this was happening, and then they gave you advice so that you could make changes and you could turn it around, right? That's not what they do. And so this post, right, it was kind of a venting post in the Facebook group, and you can really appreciate where she's at, right? I don't know anything about the medical history of the woman that posted this, but just sort of reading between the lines here, right, it would be a reasonable assumption that since she was returning from a neurology appointment, she probably went to her primary care doctor first, just like I did, right? And that's what most people do. They go back to their primary care doctor and they start with, the Imitrex, just sort of like the frontline medications that a primary care doctor would feel comfortable prescribing. And then as you take the Imitrex, right? For most people at first, usually the Imitrex works pretty well, right? And so again, it's the same sort of thing that we tell ourselves. All right, well, I certainly don't want to have to take Imitrex. I don't want to have to take any medication. That's the last thing I want. But I guess, if I have to take something to function a few times, right, I guess I'll have to do it, right? We kind of go down that road mentally, but just like what happened with the Advil, the same thing happens with the Imitrex. And then the Imitrex isn't giving us relief anymore. And so we're having more and more migraines. The severity is getting worse and worse. And now we're maxed out on our Imitrex, right? You're only going to get 9 to 12 a month because if you take more, you're going to go into rebound, right? This is why insurance doesn't cover more than 9 to 12 Imitrex per month, because your insurance company doesn't want to enable you or pay for medication that's going to put you in rebound, which is going to require additional medical care to get you out of. So now, right, now I'm taking, 9 to 12 Imitrex per month, and I'm really suffering. The Advil's long gone. That doesn't work at all, right? So your primary care doctor at that point is going to say, okay, we're going to need to do a preventative, add on additional medication. I'm a primary care doc. I got a ton of people in the waiting room. I got to keep people moving. Let's send her to the neurologist, right? And so we get the neurology referral, right? This is where a lot of heartbreak really comes in. I have had so many clients where they have suffered like this. They've been going to their primary care doctor. And again, this is not a critique of primary care doctors. Most people really, really like their primary care doctor. Primary care doctors are doing their best, and they got into medicine in the first place because they want to help people. So this is not a criticism of primary care doctors or any medical doctor. The primary care doctor, they've got to keep things moving, and you get that neurology referral. And this is where a lot of heartbreak happens. I can't tell you how many clients I've had that they've exhausted all of their options that their primary care doctor feels comfortable doing for them. They've probably had to wait 3-6 months for the neurologist appointment. And the expectation going into seeing the neurologist is that the neurologist, okay, finally I'm going to get the workup that I've been expecting, right? With, the primary care doctor, okay, it was a 12-minute appointment. It was, quick. It wasn't a lot of detail. Okay, now I'm going to the specialist. This is where I'm going to be able to tell the whole history of this. Certainly the neurologist is going to figure out what's causing these migraines and then help me make the changes that I need to make to feel better, right? So many times people have waited so long for this neurology referral, and in the meantime, they're really suffering. And then they go in with this expectation, and that expectation is not met. Because again, the neurologist, as a medical doctor, is operating under the same sort of checklist or algorithm that your primary care doctor is operating under. The difference is the neurologist is more used to prescribing some of the, if you want to call them, stronger drugs that are used for migraine prevention that maybe your primary care doctor, maybe they don't prescribe that often. They're, not that up to date on the dosing. They're not that knowledgeable on how to evaluate the medication response, increase dosages over time, right? So they say, well, just go to the neurologist for that, right? That's what they do on a day-to-day basis. But it's still going to be medication. It's still the same sort of checklist. So what might happen with the neurologist is they might do a little bit more digging to confirm the diagnosis, right? So I've got a new patient, they're coming in with a chronic migraine diagnosis. Well, let's rule out a few other possible things that could be going on, right? So they might send you for the imaging, for the first time. They might be doing more neurological testing in the office as part of the physical exam, just to rule out other neurological conditions. But, most people are not misdiagnosed by their primary care physician, right? But at the neurology office, it's sort of like, okay, we're just going to really, really make sure that the medical diagnosis is correct, which it usually is. And then it's the same checklist, right? Because the standard of care for migraines is the same for primary care physicians as it is for neurologists. It's not a different standard of care. There isn't a different set of drugs. So the neurologist then goes through and asks the patient, have you tried Imitrex? Yes. Okay. Have you tried anti-nausea meds? Yes. Have you tried CGRP antagonists? Yes, right. Okay. So the neurologist is going to run through the checklist and confirm, okay, you've already tried these things that are first on the list. Now we're going to keep moving down the list, right? And so now we're going to get into Topamax, a daily preventative, using the CGRP antagonists as preventatives, like Nurtec as a preventative, not just an abortive, right? And if you aren't going to respond to something like Topamax, right? Okay, we're going to keep going down the list. We're going to try nortriptyline. We're going to try to get you approved for Botox, right? We're going to just keep moving down that list. But it's still always going to be medication because the medical doctor is not looking for the same root cause that you are looking for. I think intuitively, most of us know that if we give our body what it needs, it's going to feel better. I just need help understanding what my body needs, right? And if I'm at point A, how do I get to point Z, right? Somebody help me, I don't know, right? And then also with migraines, because any little thing can make us tip into a migraine, right? We have to be so careful. And so a lot of times we're afraid to even make positive changes, right? Because we're afraid that it's going to tip us into a migraine, right? When we're struggling with chronic migraines, just going to bed earlier, or waking up a little bit earlier, right? Like I'm going to do better with my sleep. So I'm going to go to bed a little earlier and wake up a little earlier. Well, that could be a great way to get a migraine, right? Even making a health supporting change like that. So it's like, somebody help me, right? Help identify what my body needs. and then help me make the changes that are necessary, because I want my body to feel better, and I know intuitively that if I do that, my body is going to respond and feel better. That's what most of us intuitively understand about our body, but the medical doctor doesn't think about health and disease that way. I can imagine that a lot of medical doctors, when they went into medical school and decided to dedicate their life to helping people who are suffering, again, this is not a criticism of medical doctors. I have the utmost sympathy for medical doctors because, any interview that I've heard of, a young person, a college student that's a pre-med major, they are, it's no joke being a pre-med major. I was not a pre-med major, and before I went to naturopathic medical school, I spent 2.5 years working full-time and going back to school at night to do all of the pre-medical education. It's tough. It's no joke. So, young people that are interested in medicine, they have a good heart. They have compassion for humanity. They want to help ease suffering. I totally get it. I couldn't be more sympathetic. But unfortunately, allopathic medicine, or what we might call conventional medicine, the type of medicine that medical doctors are trained to practice, doesn't believe that your body can heal and recover itself. Allopathic medicine believes that once your body starts generating symptoms, your body's broken and defective, and there's really nothing you can do about it. I was just listening to a podcast this morning when I was getting ready for my day. A dermatologist was being interviewed, a conventional dermatologist, and there was a question about rosacea. What can you do for rosacea? And the dermatologist said, well, there's really nothing you can do for rosacea because it's a chronic inflammatory skin condition. So the best you can hope for is to sort of like cover it up with like green tinted concealers and things like that to kind of color blend the redness on the face. Oh boy. I have clients with rosacea. Rosacea is a symptom that there's a toxin overload in the body. And when we lower that load, the rosacea gets better. I've seen this repeatedly. But the medical doctor, the expert dermatologist, New York City dermatologist, right? So she's on the podcast because she's, an esteemed dermatologist. Oh, there's nothing you can do for rosacea. That's a chronic condition of the skin. They don't believe that if you develop a chronic condition, you can recover from it. They don't believe that the chronic condition, whether it's migraines or rosacea, they don't believe that those are symptoms that your body will stop generating when it has what it needs to function properly. Medical doctors, allopathic medicine, believe that once you have that diagnosis, oh, we've got rosacea, oh, we've got chronic migraines. Once you have that diagnosis, you're going to have it for the rest of your life. Your body is now stuck. It's defective. It stopped working properly. And there's really nothing you can do about it. So if that were true, what the medical doctors are doing makes perfect sense, right? I'm going into my primary care doctor going, okay, yeah, there's got to be something here, right? There's got to be something, that I'm inadvertently doing, something that can be turned around and corrected. I'm willing to make changes. My medical doctor is not looking at my migraines from that perspective at all. My medical doctor is going, okay, so this is happening. She's saying intermittent. She's saying it's predominantly on the right side. She's saying she has a lot of nausea, fatigue, right? She's just going down the diagnosis checklist and saying, yeah, migraine. Yeah, 24, defective, right? Another tragedy. There's nothing to do now. If that were true, it would make perfect sense to give me an Imitrex. If that were true, you don't need more than 12 minutes in the appointment. That's why the insurance companies don't pay them to spend more time with you, okay? Because you don't need a lot of time to make a diagnosis for most health conditions, right? There are some sort of, uncommon health conditions where you're going to have to spend a lot of time and do more of a workup. But migraines are one of the most common chronic health conditions that people suffer from worldwide, right? So it's pretty easy to determine the diagnosis. You don't need a lot of time, right? It's not a health condition, thank goodness, that, you're going to have kidney failure with. You're going to have blood work that's totally off and we need to put you in the hospital, right? Thank goodness it's not that severe, right? So it's not something that takes a lot of time to make the diagnosis. And once the diagnosis is made, all they do is move through the standard of care checklist and move through the drugs in order of sort of, most likely to be effective and most likely not to have side effects, right? And they just run through that list until they find something that, quote unquote, works for you. What works for you is suppressing the symptoms. Okay, so this is the fundamental mismatch that we have when we go into the doctor. And this is the mismatch that I got slapped in the face with when I went in, because I was dumbfounded. I could not tell you how dumbfounded I was. When I was, I felt like I was just rushed out of there, right? Because I'm like ready to tell this whole big story, and then boom, 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 right? And this was back in the 90s when you actually left the office with a paper prescription. But my emotional response was so significant when this happened that I can still picture myself holding the prescription note in my hand and feeling the feeling of being dumbfounded, right? Like, what just happened here? I don't want a prescription. I thought doctors told you what was wrong so that you could fix it, right? You could make changes and fix it. So I was just completely shocked that this happened to me. Hi there, it's Dr. Leslie. If you're a woman having 8 or more migraine days a month, let's talk. I'll show you how to drop them to near zero in 90 days. And that's without adding more medication. In fact, you can even lower or possibly even completely wean off of your medication within 90 days. And that's without any agonizing cold turkey withdrawals. So let me tell you about one of my clients, Judy. She was nearly bedridden because she was having to take such strong medications for her migraines, and she could barely function. In fact, she had to close the doors of her small retail business, and she was feeling like a failure. She wondered every day, why was she doomed to suffer from migraines? But just like you, she found this Healing Migraines Naturally podcast, and a spark ignited. She knew that if she could just figure out why these migraines started in the first place, she could restore and recover her health again. So she booked her free consult call, and the rest is history. Now she reports months in between migraines and runs her small business full-time again. She followed the 12-week plan and got incredible results, and she's completely weaned off of all of those preventative medications that were leaving her feeling doped up and committing her to being bedridden. I have worked with women just like Judy from all over the United States overcome migraines naturally. So if you're serious about healing your migraines, then tap the link in the description and book a free consult call with me, just like Judy did. We do cap new clients monthly, so if the calendar is full, the doors are closed for now. So don't wait to reclaim the life you deserve to live. No matter how hopeless things seem now, with expert guidance, your body can heal and recover. So I look forward to chatting with you. Click the link now to schedule your call. And unfortunately, right, this is a recurring experience for people. And, tragically, by the time someone is given that referral to the neurologist, right, their hopes are now so high, right? But finally, somebody's going to listen to me, right? Finally, somebody's going to take a detailed case. Finally, somebody's going to dig into this. And they're not going to, because, again, if what they think were true, their actions are logical, right? If you're coming in and you have migraines, and that means that there's something defective, you've got a neurological defect and it's never going to recover, it makes sense that we're going to try to give you something that's going to prevent you from feeling the symptoms, that's going to suppress those symptoms and knock out the symptoms, right? So like I say, it's logical when you understand the point of view that they're coming from, because we intuitively know that this is not actually true. It's very upsetting. It can be very demoralizing. People will leave doctor's appointments in tears. Absolutely, they will leave in tears because the shock is so great, and the dissonance between our intuitive knowing and the doctor's mindset around chronic disease. It's a total disconnect, and it can be very demoralizing and upsetting. So this is why it's very important that you see a healthcare provider that is coming at your migraines from the same perspective that you're coming at them from. Okay? Now, there are some people who believe that chronic migraines are an incurable neurological condition. And so for them, it wouldn't make sense for them to work with somebody like me. It would make sense for them to go to a neurologist and get medication that is suppressing the symptoms of the chronic incurable neurological defect condition that they have, right? That would make sense for that particular person. Their sort of worldview, their mindset, their understanding of their migraines is congruent with their medical provider, right? And so that person, I feel for that person, because unfortunately I know that they're going to go from medication to medication to medication. The migraines are going to get worse and worse over time. Every drug that they take is going to become less and less. And unfortunately, migraines, it's not only is it one of the most common health conditions worldwide, it is one of the biggest reasons why people become disabled worldwide, right? So I feel for people that have that understanding, that mindset. Unfortunately, it's a false understanding, but I understand that millions of people have that understanding. Why wouldn't they, right? We are told that this is true, that this is the case, and the doctor believes it to be true, right? So I understand why people have this mindset around their migraines. Unfortunately, when we believe something that's false, we're going to suffer the consequences of that. And it's very unfortunate. But I understand it. And like I say, if someone has that understanding of their migraines, they should work with a provider that has the same understanding. But if we have, again, a lot of people have more of an intuitive understanding, right? That's counter to the dominant mindset within our culture around health and disease and around their migraines. And so when those people go into the medical doctor, they come out like I did, right? They come out shocked. They might come out in tears, right? And so you want to sort of do that internal check, that gut check. What is my intuitive knowing? What do I think is the case about my migraines? And if I think that there's actually a real underlying root cause, right? That if I knew what it was and I could take the right steps to give my body what it needs, my body is going to respond and I'm going to feel better. And these migraines are going to start to become less and less frequent and less severe. If that's your intuitive understanding, then you want to work with somebody that is coming at your migraines from the same perspective, right? And so, of course, as I said at the opening, I do work with women around the country who have that same intuitive understanding. That is actually true, right? Because the body can heal and recover itself if we give the body what it needs. It's going to respond to that, and it's going to improve. It's going to get closer and closer back to a state of health. And that's not just the case for us humans, it's the case for all life on the planet. All life on the planet has a self-healing, a repairing mechanism, and we are no exception. But we are very complex. We have a physical body, and we have a mental and emotional component. So we're as complex as like a tree is, we are even more complex than a tree. But if a tree gets hit by lightning or gets burned in a fire, the tree has a healing mechanism, right? It can repair and recover from that injury, and it can continue to function. And we are much more complicated than a tree, but if there is some sort of injury, if there's something that's lacking, if there's some missing pieces that are required, if we've had a traumatic event happen to us, we may be injured, but if we take the right steps and take the right actions, our body can heal and recover and repair itself. And I'm sure you've experienced this phenomenon in other areas, right? Every time, right? How many times have you cut your finger chopping vegetables, right? Your finger is still not cut, right? The skin recovered and repaired itself. And you probably can't even see where you cut yourself anymore, right? It completely repaired itself and it looks just like it did before the cut. So that healing mechanism that we see play out every time we cut our skin is at work in a larger way, even for chronic, debilitating health problems like migraines. So this woman who posted this little vent in the Facebook group, what this is telling me is that she's butting up against sort of the internal knowing that she has, right? Because she even threw out a hypothesis. She says, I think it has something to do with my sleep, right? So again, this is the mind saying, you know what? I could take action. There's something driving this. And if I knew what it was, I'll take action, right? I'm willing to change. I'm willing to take action on this. But I need to know what it is, right? And so she's kind of like, she's generating some hypotheses, right? Well, I think it's my sleep, right? So, but my neurologist, he's not asking me about my sleep, right? He's just giving me the next medication that's on the list, right? Because again, your neurologist is not thinking like, oh, she could do something differently and this will improve. He's not thinking like that. They're not trained to believe that the body can heal and recover itself. A fixture within naturopathy that I've been trained in, the system of medicine that I've been trained in, the fundamental assumption in that system of medicine is that if you give the body what it needs, it's going to respond and it's going to start feeling better and better, and it's going to start to return itself back to a state of health. And when we're in a state of health, our body doesn't generate symptoms and we feel good. So I hope this helped. Probably if you've been listening to the podcast and you've been struggling with chronic migraines, I would assume that there's some elements that you can really relate to, both in my story and this vent that was put into the Facebook group. So again, if this is information that resonates with you, please subscribe to the podcast, leave us a comment, help us get this information out to people. And of course, if you have that same sort of intuitive knowing that I have and my clients have, reach out and let's see if I can help you too. Very good. See you on the next one.